37,892 is the last reporting period, total number of cases, tracking slightly below the 43,901 average number of daily positive cases that we have experienced over the last 7-day period. Now, some have inquired over the course of this weekend, the last number of days, suggesting or at least inquiring as relates to what they perceive based upon the data that's come in the last 4 days, that we may be seeing a modest, very modest decrease in the growth rate, total case growth rate. Still too early to tell, and I caution people not to read in again to weekend numbers, but we'll take a close look at this in the next few days, and of course make that data always would make it available, but to give you our assessment, professional assessment, Dr. Ghaly will talk in a moment. He can give you a side of that as well to see if he thinks that is indeed the case. Still too early to tell, but nonetheless, good to see the number the last 24 hours tracking a little bit below that 7-day. Let's take a look at the 7-day testing average, little over, or rather just shy, I should say, of 330,000 tests. By the way, yesterday, we reported over 395,000 tests, so close to 400,000 tests in the last reporting period. But you take a look over a 7-day average, roughly 330,000 tests. Want to still see that test number increase. We're starting to see those numbers increase, which is encouraging news. You get a sense of course, the positivity rate now in the state, 12% positivity. That's over a 14-day band. Let's take a look as we get to this next slide, where we were just 14 days ago, though. That 12%, we were at 8.7% just 14 days ago. So you see that rate of growth, that trajectory growing rather acutely. Hospitalizations, not surprisingly, 63% increase over a 14-day period. You're seeing that same trend line, 17,190 individuals hospitalized that are identified as COVID positive currently in our hospital system. The ICUs tracking with 3,644 patients now in the ICUs, a 51% increase in admissions as well over a 14-day period. The death rate is climbing as well. Sober reminder of how deadly this disease is and how tragic the loss of every life is, but particularly those lives that are lost during the holiday seasons with loved ones and family members torn asunder because they don't have their loved ones at home or even the ability to call. And so I just remind people of this fundamental point, and that is this disease remains deadly. And just take a look at the lives that have been lost just over a 14-day period, 2,741 people no longer with us, just over a 14-day period, an average now of 233 lives lost on average every day over the last 7 days. Again, those weekend reporting periods often lag. The 83, though extraordinarily high, I know looks to be more modest compared to the average, but that often is misleading on a Monday. And the reporting period's really the average daily rates that we should be very, very mindful of. 233 lives lost over that period. Here's a chart that more and more people are getting familiar with, and that's the regions in the state that are in a scarcity frame, now in a surge frame as it relates to ICU capacity. 2.5% is the statewide ICU capacity. That's in the aggregate. I always say this, and forgive me for saying it yet again, none of us live in the aggregate. So that's nice to see. 2.5% is low a number as that may appear to be, doesn't mean much if you don't live in a region that is also detailed and exampled here. And that's why we include not just the state number, which could be misleading, but if you're in the Bay Area at 13.7% ICU capacity, Greater Sacramento region 16.2, northern part of the state, the northern regions of the state, a little higher at 28.7, but you can see the real hotspots right now. San Joaquin Valley at 0% And in Southern California, the most populous part of our state, at 0%, now in the surge phase of the ICU planning. So again, just because it's at 0 doesn't mean there's no ICU available. It means we're now in the surge plan. 20% plus or minus is the surge capacity pursuant to the plans that we have socialized and are now being utilized and advanced in those critical regions here in our state. Take a look at the regional stay-at-home map. 98% now of the population in the state represented in the update. San Joaquin Valley, Southern California, Greater Sacramento and Bay Area. Again, it's just the northern part of the state that's not in that stay-at-home. You can see as it relates to the stay-at-home that we are likely, I think it's pretty self-evident, going to need to extend those original dates. You may recall that the expiration in San Joaquin County was on the 28th of this month, in Southern California, the 30th of this month. Based upon all the data and based upon all these trend lines, it's very likely, based on those current trends, that we'll need to extend that stay-at-home order. You recall it was a 3-week order when we announced it a few weeks back, just previewing the likelihood of those stay-at-homes being extended, certainly in those two regions.